Simply Women's Health with CJ. Today we're going to talk about the OB healthcare team, who's who. So during pregnancy, there's a number of different people that can be with you during your prenatal journey. One of those is might be an OBGYN, a physician who specializes in obstetrics, pregnancy care, and gynecology, women's health care. The OBGYNs can see you throughout your pregnancy. They can do your vaginal delivery. They can also perform a cesarean section if that is what's needed to get your baby here safely. Some patients are followed by their family practice or their general practitioner. Those are physicians who have extra training in OB care, and they can manage your pregnancy. They can deliver your baby just as well. Some patients opt to see a midwife. Certified midwives are typically midwives that practice in the hospital or medical setting. Those are nurses who have received advanced degrees, whether it's a master's degree or even their PhD. They take care of you throughout your pregnancy. They can also manage you outside of pregnancy and do your women's health care. They work in the hospital, as I said, and they do vaginal deliveries only. There are midwives who are not certified, or who are certified but who are not nurses. There are also midwives who do not have any certification. They're often either self-taught or they have gone through an apprenticeship. Those are called lay or traditional midwives. They typically don't work in the hospital setting. In some states they might, but in the majority of states they're the ones that will come to your house or deliver you at a birthing center. They do not do cesarean sections, and typically they don't take care of you outside of your pregnancy. You might see a nurse practitioner. Two different kinds of nurse practitioners that take care of pregnant women. One is going to be a family nurse practitioner, and one is going to be an actual women's health nurse practitioner. Nurse practitioners can take care of you throughout your pregnancy. They can also take care of you outside of pregnancy, managing your women's health issues. They do not deliver babies as nurse practitioners. They stay in the clinic. They don't come over to labor and delivery unless they're there to be a cheerleader. That's what I do. You may have a doula. Doulas are basically people who have been trained to help families go through transition. OB doulas are assigned to help you throughout your pregnancy. They provide information. They help with different questions that you might have. They provide support during your labor, and they can be there to help advocate for you during your delivery process. The doulas will often help follow up with you after you have the baby. They may come to your house and make sure that the baby is feeding well, and they may make sure that you are recovering nicely. Doulas do not do deliveries. They are there strictly as labor and delivery support people. Your OBGYN, or your labor and delivery nurse, your L&D nurse is going to be your partner throughout the birthing process. They are there to take care of you and your baby. They are there to provide the support as you give birth, and then they will be there to also check your baby out as soon as he or she is delivered. Hi, if you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement for a visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.